Hi everyone. So welcome to today's seminar. I'm Lu Chen. I'm postdoc at the Wellcome Center for Cultures and Environment Health. So this is the last session of the seminar series, Gender and Health, discussing socialism and transformation after Second World War. And this wonderful seminar series is organized by my amazing colleague, Andrea. So because Andrea is going to give us a presentation today, so I'm going to moderate this session on Andrea's behalf. And this seminar is part of the work we are developing for the project Connecting Three Worlds, Socialism, Medicine, and Global Health after World War II. So in this seminar series, we have shared ideas and explored women's experience and gender-related systematic transformation in health cultures, political participation, and state building after the Second World War. So the idea behind this seminar series was to reflect on the role and spaces occupied by women. The theme of today's session is women's bodies, family planning, and the Cold War in Latin America. And today we have two presenters sharing their research with us. I will introduce them and then we will start the presentations. And we will have a Q&A after we finish the presentations. And just a reminder that the seminar will be recorded and uploaded to our center's YouTube channel. So our first presenter today is Dr. Teresa Hull. So Dr. Hull is a research assistant at the Department of Iberian and Latin American History, Institute of History at the University of Cologne. So she's also a visiting researcher at the University of Republic of Uruguay. So the title of her presentation today is Women's Voices in the Transnational Debate on Family Planning and Population Control in Cold War Colombia. And the second presenter today is Dr. Andrea Espinosa. So Dr. Espinosa is a postdoctoral research fellow at the University of Exeter. She works in the Connecting Three Worlds, Socialism, Medicine, and Global Health after World War II. So Dr. Espinosa examines how political ideologies shape sexual and reproductive health policies and discourses in Latin America. So the title of the presentation is Reproduction and Control in Guayaquil's Vulnerable Urban Communities between 1965 and 1985, Women's Liberation Without Women or Liberation. So without further ado, Teresa, you can have the floor now.
Thank you very much for the nice introduction. Thank you everyone who's joining us this afternoon. I think you mentioned, Lou, that I'm a visiting researcher in Uruguay. This is, has been true until about a week ago. So now I'm speaking to you from Cologne, Germany, and surprisingly with afternoon sun, and I'm somehow not able to close the window. So I hope you can still see me, and I hope I can see my screen, but it looks quite well. Yes. So thank you, Andrea, for the invite. I was very happy to receive it. I'm also, in the context of the seminar series, I have to mention what I'm going to present is not a history of socialism. It's a history of Cold War-inspired family planning in Colombia, and of how family planning was coercive on the one hand, but also a space that Colombian women appropriated at the same time. And it's this tension that I want to talk about today. I'm still, yeah. So I have structured the presentation in three parts. The first part, an introduction, then the second part that I call Women's Body is about this coercive aspect of the family planning history, and then the third part, Women's Voices, refers to what I just defined as an appropriation or using new spaces. Let me give you a brief side note on this picture, because I'm going to show a couple of pictures that depict, or historical pictures that depict family planning. And they were taken by a US American sociologist and demographer. His name is Dykes. I worked on him quite a lot, and he was not only a sociologist and demographer, but also a social photographer, and he has published several books that, according to him, served to give the human face to the abstract population problem. He did not deem it necessary ever to include any information on the exact place where he took those pictures or the date. So they were to represent the population problem in Latin America. And that's all I know. But he did a lot of research in Colombia. So we can assume that those pictures might be from Colombia, but I just don't know. I just want to say that to not give you a wrong idea on what these pictures are and aren't. But I think as a side story to my presentation, they are an interesting reflection of this visual take on family planning on the part of the experts, or US American expert in this case. What I'm presenting here is based on archival research for my PhD thesis, which was published in German. You see the book here. It translates as Population Fertility and Family Planning in Colombia, a Transnational History of Knowledge in the Cold War. It was published already in 2017, so this is not my most recent research here I'm presenting, but I have, of course, never lost interest in the topic, and I'm also keeping track the best I can of the more recent literature. In the thesis or in the book, what I wrote, the history of knowledge, is more than anything an analysis of the production of knowledge on a family planning population in Colombia. So it's a history of sociology, a history of demography, a history of medicine as well. In my presentation, I will stick rather closely to some of the sources I've been working with and providing you with a number of quotes, etc. So let me start by the introduction part. The history of Colombian family planning programs starts in the early 1960s, or more concretely, 1962, 63. It was when family planning moved out of private practices and into the public health system. First, in the form of pilot programs and strongly or intimately linked to the country's medical schools. And then starting in 1966, family planning was also conducted with more direct involvement by the Ministry of Health, which started to cooperate with the medical schools on the one hand, but also with US financing and organizations with USAID and the Population Council on family planning programs. And one of the pilot programs that I've been looking at most closely took place in a town called Candelaria in the Valle del Cauca in Colombia, close to the city of Cali. And this is where these two pictures are from. On the one, you see two physicians who are engaged in demographic work. And on the others, you see mothers who, according to this publication, belong to a mothers club from the pilot health center. And since this is the place where the family planning program also started, we can imagine that it was women like these who participated in these first programs. As many of you most certainly know, the history of family planning in Colombia, but also many other places of the world, cannot be told or understood without the important role of international players, transnational actors. In the case of Colombia, the most important ones would be the Population Council, the Rockefeller Foundation, and the Ford Foundation. These three sponsored and promoted family planning programs, but also research in 1960s and 70s Colombia more than anything. And these actors also hint us to why family planning is a Cold War history, is a history in which the elite threat of the so-called population bomb resonates with the atomic bomb and with the role of the so-called Third World within the Cold War equation. So this is one of the many famous publications that transported this threat, an early example from 1954, a pamphlet. And I'm going to give you a quote from the back cover of this pamphlet, which illustrates what I just said. So this pamphlet has been prepared by an informal group of business, labor, and professional men concerned with preserving world peace, arresting communism, and improving the lot of people in overpopulated countries. Within Colombia, the most vocal and influential proponents of state involvement and population control also spoke about this lot of people. And to illustrate this, I'm going to quote from a speech by Alberto Lleras Camargo that he gave in 1965. He was by then former president of Colombia, and this picture with the Kennedys was taken during his presidency just a few years earlier. So the quote, you see it here in Spanish, I'm going to read it in English, goes as this: waves and waves of human beings, illiterate and half barbarians, half sick, badly eaten, badly clothed, badly shod, homeless, continue to contribute to the distribution of misery without participating in production and almost without intervening in consumption. The human solution, the Christian solution, the economic solution, the political solution is birth control, and the sooner the better. Alberto Lleras' perspective on the population that had to be controlled found a quite direct translation in some of the medical perspectives on how to exactly proceed with the birth control that he was calling for. And this perspective that I'm going to delve into for a little while had little room for informed decisions by the targeted women, as the next quote will show. And I'm going to quote first and explain the content second. So here it says: finally, each of the health centers would be given adequate facilities and provision of coils. He, Gabriel Velázquez, estimates that each of these 30 physicians can treat 30 women a month, thus covering about 400,000 women a year, or in 2 years, nearly half of the women in the reproductive age period. On our last morning, a breakfast meeting was called to discuss this program. With these words, Stijkers, exactly the sociologist and hobby photographer that I mentioned earlier, summed up a meeting with Colombian doctors and representatives of US organizations. He himself had participated for the Population Council. What is described here and was discussed over a breakfast among men, again in 1965, is simply called the plan in numerous sources. And the man quoted here, Gabriel Velázquez, was the dean of the Faculty of Medicine at the Universidad del Valle. Nothing less was planned here than to insert an IUD into 800,000 Colombian women in 2 years. And IUDs were the favorite technology of the physicians who were aimed at reducing population growth among the women they considered too little educated for methods which implied a more active role on part of the women. So the IUD was a preferred method because only physicians could insert and remove it. Beyond this this general plan outlined here, it never materialized just in those numbers, that's for sure. But beyond this more general planning, the physicians in Cali and their transnational allies, they also looked for specific places in which they could start inserting IUDs. And yet another quote will illustrate how they were looking for those places. This is from a Rockefeller Foundation officer's diary. On October 22nd, GVP, so again, Gabriel Velázquez, and I had a long chat with Dr. Carlos León about the possibility of using WWII Cauca for a pilot program aimed mainly at determining IUD acceptance in an isolated, predominantly Negro population. Carlos León thought this was a fine idea. There's a local bishop who is said to be a liberal Franciscan, and there are 2 Peace Corps volunteers who have established a close rapport with the populace. So the debate about where to start with the insertion of IUDs reflect that doctors took it for granted to experiment with women's bodies and considered certain racialized bodies particularly suitable. The same Rockefeller physician who reported here on the idea of using this isolated Negro community, he also in his diaries for the foundation, for his superiors in New York, he also in those diaries often wrote about discussions within the Colombian medical community with regard to whether or not it was morally legit to even use the IUD. So the Catholic dimension of this issue, or the question whether or not Catholic arguments would prohibit the insertion of IUDs. Possible solutions to this dilemma, which certain physicians saw and others didn't. The possible solutions to this dilemma again show a high disregard for women's bodily autonomy. Again, a quote from the same Rockefeller officer. He reported on a seminar on family planning that had recently taken place. We are now in 1966, and he writes, "The broad training program passed unscathed, and I had the impression that even some of the original dissenters were relieved. One of the suggested gimmicks was that in the training of physicians to insert IUDs, any moral problems could be resolved by withdrawing the device immediately after insertion." This is certainly a drastic example of how physicians were discussing the use of contraceptive technology in the decades. And what's interesting is, I haven't found much feminist or explicit feminist critiques against such proposals and practices from the 1960s. Maybe that's due to the kind of sources I had. Maybe it's also because these kind of critiques were rather formulated a bit later. But I did try to see in how far women participated in family planning programs and research, and there it is quite obvious that on the level of physicians, there are not so many, but in every other level of family planning programs and research, women were also involved and obviously were the main users or targets of these programs. So what I tried then, even though the perspective of these users was not the main focus of my research, I have still tried to look for their perspective. And yeah, it's interesting that even though my sources actually all come from family planning advocates and from researchers, the agency of the targeted women shines through these sources, usually in the moment when the physicians or the international experts complain about deviant behavior on the part of the women. So I do think we see in the sources that despite some of the physicians maybe not caring so much about the bodily autonomy of the women they were working with, that on the part of the women there was a real demand for contraception. They sought the access, but at the same time they were not interested in the rules of the providers. So for example, researchers in the area of Candelaria, Cali, they wanted to evaluate the relative effectiveness of distinct contraceptives. So in different villages, they offered different methods and then wanted to do a study that compared them. But this didn't work because the women who were in one village and were supposed to only use, for example, the rhythm method, they traveled to the other village where the IUD was being used because that's what they wanted. And yeah, this is then a complaint by the researchers whose work doesn't work anymore the way they wanted to. And similar, there are several complaints by doctors that women sought access to contraceptives through the family planning programs, but they did not take part in the educational programs that were supposed to happen at the same time, education about why a small family is better, etc. So there we have women who, I think that's also a moment of agency, women who seek the methods, but who don't obey to the educational program that comes along. So my next look is at female researchers and work involved in family planning. There it's interesting and maybe also obvious since the beginning in the early 60s, women participated actively in all stages of the production of knowledge on population growth, reproductive behavior, and family planning. Here just two examples. They belong to a large series of books that analyze the results from what was the first so-called National Fertility Survey in Colombia in 1969. So these publications are from the 70s and are based on surveys from 69. The second of these studies, which translate as regional differences of fertility in Colombia, the author Margarita Wills-Franco here argues that patriarchal societies reject female insertion into the workforce, and she formulates this as a critique because she and many others have come to know, and unsurprisingly, that work was an important variable when it came to the number of children women gave birth to. So in her own words, she writes in the study, in the introduction to her study, women's work is culturally rejected in a society that exalts macho and patriarchal values, where economic responsibility falls on the male and where the image of wife and mother is rewarded and exalted. If we then move to the 70s, and that's where when I use now my last two examples, or where my last two examples belong to the 1970s, it's a different time in Colombia in many senses, but it's also the decade where a second wave feminism takes off. And I think it's striking from what I know about this, just how many prominent feminist scholars of the 1970s are linked in the beginning of their career to organizations which come from the world of family planning and population control. And that's what I'm going to show with my last two examples. Example number one would be an association, the Asociación Colombiana para Estudios de Población, ASEP. That's an organization that was founded in the early 1960s, and at that moment in time was very clearly linked to the big sponsors of family planning, to the idea of curbing population growth. However, starting in the late 1960s, the same organization was used as a forum to demand women's rights, such as equal access to education and work. And as I said earlier, family planning researchers were interested in all variables that could contribute to women reducing the number of children. So the topics of education and work came on their radar, and they were discussed here in a series of conferences that had the title, The Colombian Women and Her Responsibility for the Development of the Country. At these conferences that started in the late 60s, academics and women from social professions came together to discuss topics such as family, work, and education. They conveyed an ideal image of a well-educated and working woman at the same time, also a responsible mother. But these conferences went beyond that, and they formulated concrete demands towards the Colombian state, and these demands included, for example, state campaigns on the importance of education for women, on the enforcement of the right to free and compulsory primary education. Explicit calls were made for the division of labor in the household, for reforms to improve women's access to the labor market, and for equal pay for equal work. And one key figure at these conferences was a sociologist, Magdalena León de Leal, whom you see here on a picture from the 1970s, and whose career as a feminist scholar starts right here at these conferences. Then the second example, and with that then I will be finishing up my presentation. The second example I want to show you is how family planning opened up discursive spaces for the topic of sexuality or female sexuality and sex education. Here you see a gynecologist, Cecilia Cardinal de Martin. In Colombia, she is regarded somewhat of maybe the pioneer of sex education. And just as the sociologist just mentioned, as I said, her career also starts in relation to family planning organizations and funds. She used these resources to strengthen the topic of sex education and to change ideas about female sexuality. Retrospectively, she explains that she actually the family planning organizations reached out to her, that first she didn't want to cooperate, but that they promised her absolute autonomy in her research, and that's how she came to cooperate with them. But also retrospectively, she formulated fierce criticism of the family planning agenda, and I'm gonna quote again or translate the Spanish quote. She wrote in 2005, and there means in the family planning world, the woman counted for nothing. She was a uterus, she was a few vessels, she was a few fallopian tubes that had to be separated so that she wouldn't have so many children. The woman was still a machine. In the past, she was a machine for having children. Now she was a machine that needed to have turned a few screws so that she had fewer children. The woman was still an object, and it didn't matter what she thought, what she wanted, what she felt. Nevertheless, she also retrospectively called family planning a door opener and said explicitly that in her eyes, it had become possible to talk about sexuality and sex education because family planning was already something that was being talked about. And with that, I'm gonna move from her more retrospective interpretations to her first research project that actually underlines her later view on how she was breaking new ground with this research that she started in relation to family planning. Or actually, it's not in relation to family planning topic-wise, but it's financed by the family planning organizations and by the Population Council. So she had a first sex education program that started in 1970. And when she started this pilot programs, it was in 2 schools in the surroundings of Bogota. And these programs were, they came along with 2 large surveys that she developed and conducted. And what I did is a bit compare these surveys with the before mentioned national fertility surveys that conducted by the family planners, you could say, only 1 year earlier. And it's very interesting because when you compare the questions asked in the family planning survey and then in her, or in the fertility survey and then in her sex education survey, for example, the fertility survey was, they had one version for men and one for women. She differed between the questionnaire for children, for teachers and for parents, but not no gender difference. And then in this fertility survey, for example, the questionnaire for men includes question about how many parallel sexual relations they had, the different contraceptives they were using with each of these relations, and also about the possibility or rather impossibility of finding sexual pleasure within a marriage or stable relationship. And there were no similar questions in the questionnaire for women. So possible female promiscuity was invisible and excluded from the normality that this survey presented. And Cardinal de Martin's sex education survey in this regard was very different because, for example, it included questions such as, do women have as many sexual needs as men? And even though it's formulated as a question, it opens this possibility that this is something that can be thought and said. She also asked whether sexual initiatives necessarily had to be taken by men, and all her questions actually about sexual morality was were posed for both sexes. So she did convey the idea that both men and women could have sexual experiences before and apart from their marriage. Also, she had questions that opened up the possibility of separating love and sex and connecting contraception with sexual freedom and spontaneity, so not only with family planning. So I think a look at this questionnaire, at the study that she developed with fundings from the family planning proponents, show us that indeed she was able to use these discursive spaces and the money that came along with family planning to bring about new topics that had a much more feminist character. So with this, I'm ending. Just summing up very briefly, I think the history of family planning has been summarized as a tension between choice and coercion. That's borrowed from a book title by Johanna Schön. The history of family planning in Colombia for sure is full of these tensions. So we have on the one hand physicians preoccupied about population growth, whose desire to insert IUDs in as many women as possible is a story of coercion or fantasy of coercion. On the other hand, we have family planning users with their own agency, and we have a series of female and feminist scholars who jump on the family planning wagon in the late 60s in order to develop own critical agendas in the 1970s. Thank you.
Thank you so much, Teresa. So now, Andrea, you can have the floor.
Hi, thank you, Lou. Thank you, Teresa. That was really, really interesting. Okay, let me see presentation here. Share. That's not the first thing. Oops. Can everyone see my screen, right? Yes. So, I'm going to talk about reproduction and control in Guayaquil's vulnerable population between the 1965 and 1985. I make the point of women's liberation without women or liberation. So, In 1965, on average, an Ecuadorian woman had 7 children, which was more than the region's average, which was 6. Women had no access to contraceptives, and maternity was discussed mainly in relation to marriage and de facto unions. By 1985, the landscape changed significantly. The average of children per woman declined to 4, still over the region's average. However, a big change, a big improvement, let's say. This change meant more than just the reduction of the fertility rate. It was a successful process of transforming sexual and reproductive discussions into public policy, and a step forward in providing access to technologies and information so that women can have more control over their bodies. However, while women's agency and women's body autonomy were central to this process, women and their communities were not part of this conversation. The reduction of the fertility rates was a process framed as a path to alleviate social problems, that is, mainly poverty. And they were left with a legacy of shaming poor communities for uncontrolled and irresponsible reproduction. This discussion about controlling reproduction was also framed in international debates about development and fears of overpopulation, much more than in understanding the local context, culture, or even the needs of local communities. Between 1965 and 1985, international debates about fertility and fears over population had a great impact in family planning programs in Ecuador. As explained by Raúl Necochea, since the late 1940s, US demographers and politicians carried about rapid population growth potential to fuel poverty and social discontent. And Cold War accelerated these changes in expert views, changing them from considering private to make it a public matter. An example is the wording of this memorandum, this 1976 memorandum produced by the US Department of State, titled the First Annual Report on US International Population Policy. The memorandum detailed the problem of overpopulation in our own Latin American backyard and highlighted it as a security issue and a pressing concern. The memorandum also talked about being subtle in the strategy of dealing with this problem so that population control programs could see as serving the country that they were supposed to be implemented and not necessarily the US interest. In Ecuador, which by the 1960s was considered among the poorest countries in Latin America, the implementation of family planning programs was not meant for rethinking family or women's positions in society, but to reshape society. The practical implications of reshaping society started by determining the parts that needed to be reshaped, that is, the community at the margin. This presentation is to reflect on the work of one of Ecuador's first family planning institutions, that is APROFE. APROFE is an association for the welfare of Ecuadorian families. This organization started to work in Guayaquil in 1965, before the Ecuadorian state created the Ministry of Health, which happened in 1967, and start to centralize public policy. However, moreover, APROFE positioned family planning in the public discussion, and until today, it remains a respected actor in the construction of health policy. When founded, APROFE was a private organization concerned about overpopulation and its effects on development. As such, the focus of the organization work was on poor urban population, primarily in major cities like Guayaquil. Here I discuss how APROFE view and define communities and how they depicted the role of women in these communities. I will examine APROFE discourse about poverty and progress and its connection to fertility rates and irresponsible parenthood. To do so, I will divide this presentation in 2 sections. Okay, let's leave it there. The first, I will focus on the discourse about overpopulation and poverty constructed and reproduced by this organization. Then I will discuss the international connections of Ecuadorian national family planning programs as the geopolitics of the time affected the vision of development that different programs represent. On the one hand, Ecuador nonprofit find international funders to execute their programs following international concerns about progress and development. Nonetheless, the same international context boosts local tensions that pointed to family planning programs as foreign intervention. The Ecuadorian left, for example, claimed that APROFE was an instrument of the US for population control, and the defenders of APROFE accused the left of radicalization and pursuing political agendas imposed by socialist countries. Finally, I will remark that women were seldom mentioned in any approach about fertility and development. While APROFE had a discourse that mentioned women's liberation and freedom to explore roles beyond motherhood, its approach to family planning primarily referred to a responsibility to the nation and its development. APROFE diagnostics over the need for family planning started with a survey. In 1968, Dr. Paolo Marangoni and Dr. Francisco Parra Gil, co-founders of the institution, surveyed 1,400 women living in deprived areas. As explained by Marangoni in his memoirs, it was fundamentally a study carried out in Guayaquil, and more precisely in the slums, which demonstrated the existence within the family institution of a social evil. This problem involved all aspects of society. Analyzing the causes of this marginalization, a common denominator within the family was found: an excess of unwanted children. From 1950 to 1974, large number of land-poor peasants living in the highlands migrated to the coast. As a result, the coast grew substantially faster than the rest of the nation. This movement of people increased the diversity of communities living in Guayaquil, and at the same time fostered the increase of informal neighborhoods. That's what Marangoni is referring to as these slums around the city. And at the same time, considering the population change and the fertility rate, Ecuador's vulnerable economic position, discourses about population control started to increase. In line with emerging development discourses, APROFE described family planning and sexual education programs as a way to reduce poverty and support poor women. In one institutional memoir, women are portrayed as living in sad circumstances, prematurely aged, lacking in self-esteem, and orphan of guidance to avoid successful unwanted pregnancies. In that sense, APROFE identifies poor women as the primary target to promote ideas about family planning. The institutional discourse, including making remarks on women's subordination and the possibility of liberation created by a better understanding of reproductive health and the access to contraceptives like the pill, condoms, and hormonal intrauterine devices. While research and programs on population control in Latin America started to popularize in the 1940s, in Ecuador, the conversation really appeared with the creation of APROFE. As in other Latin American regions, the conversation had similar characteristics. It talked about the lack of communication between sexual partners and the need of planning and responsible parenthood and citizenship. However, it also ignores women's sexuality, cultural sensitivity about women's roles in society, and their feelings about motherhood. More importantly, family planning, sexual education, and access to contraceptives were not necessarily health concerns, but a matter of economic and state planning. APROFE initially contributed to making family planning a matter of state concern. Marangoni was a member of the Ecuadorian official delegation for the World Population Conference in Bucharest in 1974. in Mexico in 1984, and in Cairo in 1995. Marangoni's work also was reflected in changes in the Ecuadorian constitution. However, moreover, a profe language really had an impact in Ecuador's laws. And this language tend to portray women as poor, passive, and sad subjects that needed guidance from the government and the elites. As explained by an institutional memoir published by a profe for their 54th anniversary, Marangoni explained, a profe has never intended to set up a family service, but rather to spread the idea of planning in society. Let us remember that at the time, uncontrolled population growth and irresponsible parenthood were eating away at the development of both individual beings and society as a whole, which is why all this goes beyond politics or state, but rather is a matter of community and the way a person supports their community. When a profe started working, they did a type of work that no one else was doing. That is, communicating directly with women about reproductive healthcare and contraceptions. Mercedes Miño, one of the first workers in the institution, recalled, I talked to women and learned about the methods the poor women use to avoid pregnancy. Some put aspirins in their vaginas, others put cotton wool soaked in lemon juice. Most were unaware of other ways to care for themselves, and they had 4 or 5 children each. I talked to them about the methods we would recommend on our clinic and invite them to visit us. A profe's approach to family planning was centered on the need to control reproduction and the premise that such control will be positive for the family and the nation. However, it positions highly top-down approaches of healthcare that portray vulnerable populations as uninformed and irresponsible individuals. A profe interventions picture a country highly connected with international debates about population control and an internal concern about poverty. Nonetheless, these concerns contrast with women's views about family and children as sources of identity and value. Ecuadorian sociologist Máximo Ponce identified that women position family as a bien valor. That means that that will be a very important asset for their life and their community. Marangoni was an Italian immigrant, part of the Ecuadorian elite, and was very connected to international trends regarding population politics. In the 1960s, Marangoni and Parra, as I mentioned, the co-founders of APROFE, had an informal conversation with the US consul in Guayaquil. They obtained information about an oncoming visit of Dr. Ofelia Mendoza, a Honduran sociologist and Planned Parenthood Federation technical director for the Western Hemisphere region. Mendoza was traveled for most countries in the region by the 1960s, identifying people who can recognize the need for family planning and encouraging to establish private associations that then will become partners of the Planned Parenthood Federation. By the end of the 1960s, Marangoni had already secured funding for APROFE. And then in Medellin, he had met a professor for Cornell University and also an advisor of the Planned Parenthood Federation and obtained an allocation of $9,000 that will help the formation and the programs created by APROFE. APROFE was able to finance the beginning of the community engagement in Ecuador. And a decade later, APROFE had already found funding from the Ecuadorian state and the US aid programs. In 1975, faced with increase of demand, APROFE entered an agreement with the Junta de Beneficencia de Guayaquil to provide family planning services at one of the biggest maternity hospitals in Guayaquil, and created a separate facility envisioned to provide external assistance that women were requiring. USAID had approved and agreed to fund the construction of equipment at the new facility. After 10 years of experience in family planning in Ecuador, Marangoni participated in what is recalled one of his proudest moments. That is, he was one of the Ecuadorian advisors participating in the World Conference of Population in Bucharest in 1974. The document Marangoni helped to write says, the Ecuadorian state recognizes men as a subject and the end of development, and the population as one of the fundamental elements of the nation's economic and social development process. It is in the national interest that all family planning activities carried out by public and private organizations be under the control and supervision of the state through the Ministry of Health, maintaining as a principle not to allow the use of methods that threaten life. The statement presents the Ecuadorian position on family planning to the world, but it also has a different aim. It responds to national accusations of the role of family planning. In a Prophet's institutional memoir, the author explained that extreme left-wing university students raided the premises of the Department of Geography and the Center of Population Studies at the University of Guayaquil. They destroyed the office and left several insults and threats to Marangoni, who was the director of the institute. Students accused him of collaborating with the dictatorship and working as an agent of the CIA. The incident ended with Marangoni abandoning his position at the university and never returning to teaching higher education. Shortly afterwards, Marangoni was invited to a meeting of the Association of Medical Schools in Cuenca. At the end of his presentation, which was based on the defense of family planning as a human right and his views against abortion, he had a strong confrontation with the audience, who declared him persona non grata in Cuenca, forcing him to leave the room. In 1975, Carlos Román Roldán Negrete published the book Imperial Penetration in the Field of Health, the Social Medical Problem of Natality in Ecuador, denouncing the imperialist plans for a collective castration of the population. Roldán was a student leader backed by the Revolutionary Left Front for Medicine, and he was a National Medical Student Association president. According to Roldán, the program supported by Marangoni concealed the country's real problem of poor distribution of resources. He also accused Marangoni of creating panic and introducing demography as a teaching subject in medical schools. Roldán's criticism about the lack of understanding of real problems affecting women resonated with the discussions of other physicians, such as Jaime Breil. Breil proposed to strengthen and broaden the spaces of participation of the mass organizations, breaking with vertical and paternalistic management skills. However, while community-based interventions were a reality in several parts of the country, particularly in the Andes, this approach did not have similar impacts on the one presented by Marangoni. Furthermore, much as in the case of Marangoni agenda, the student movement and some groups in the Ecuadorian left also forgot to invite women to the conversation about their needs. This is especially relevant as the leftist movement was not a space free of machismo. Agudelo Echeverry argued that neither the anti-imperial left nor the right-wing political currents consider what sexual and reproductive rights meant for women. I'm just about to finish here. While women were the target of the family planning intervention and women liberation was mentioned to explain this approach, between the period that I'm explaining, so 1965, 1985, women's participation in Ecuadorian society was rare. Interventions about reproductive control were left at that, facilitating women having fewer children, but they did not intersect with improving women access to education, formal work, or political participation. Very few, often wealthy and conservative women were members of institutional boards. By 1982, only 36% of women had finished secondary school. No women were part of the National Ecuadorian Assembly, and more than 60% of the population was underemployed. That is, had a low productivity or had an informal work. And most of these vulnerable workers were women. The invisibilization of women continued until the end of the 1980s, where international changes and also the really strong work of grassroots organizations start to make women more participant in the planning of policy, including health policy. Thank you.
Thank you, Teresa and Andre, for your wonderful presentations. So now it's the time for the question Q&A. So if you have any questions, you could raise your hand or post your questions in the chat box. Yeah, so Rebecca, you can ask your questions now.
Thank you so much. Teresa and Andrea, thank you so much for those great presentations. I really enjoyed that. And thank you for the entire series. This has been really great. I have a lot of questions, so I'm just going to keep them to a couple, partly because I have to run off to get a child in 10 minutes. And it's his birthday, so there'll be cake. So I have questions for both of you, and I'll just maybe ask a couple to Andrea and then just one to Teresa, if that's okay. So Andrea, I was curious about the Bucharest conference and the Ecuadorian position there. And I'm curious to know to what extent the Ecuadorian position was influenced by the new international economic order and those kinds of movements that were influencing some other country positions at Bucharest. The example that I've talked within this group about looking at is India, and the statement that was produced by the Minister of Health for India at Bucharest was very much influenced by the new international economic order. It didn't really align with what he was doing in terms of policy in the country. So I'm curious about that kind of that context. I also had like a really short empirical question about one of your slides. You had this great memorandum from 1976, and at the top of the right-hand column, it said something about schemes such as Indian schemes to encourage voluntary sterilization. And I was curious to know if that was talking about the Government of India's family planning program. And the date to me is very pertinent. It's the height of really coercive sterilization in India. This is slap bang in the middle of the emergency when there are mass sterilizations happening, sometimes forcibly. So I'm really interested to know what kind of information is being used about the Indian program elsewhere, if that's what the reference is to. And Teresa, I'm also interested in The Construction of Knowledge. A book that I'm trying to write is very much about this, looking at the South Asian context. And I was curious to know the pilot programs that you look at, because I'm looking at one in particular, but a series that were done in the 50s, which I'm trying to figure out how much they set a blueprint for other programs and what their influence is. So do you know where the pilot programs that you look at, where do they take their study design from? Do they take influences from other studies internationally? I'll leave it there. Thank you.
Maybe I can start because I have very short answers about this. The family planning, so the memorandum was based on different embassies and like they were political missions that were reporting back about the general state of population programs in different countries. And what they did in the memorandum was summarize everything. I don't know about the particular case of India or the particularities of the case. I know that the memorandum is very long and it mentions a lot of India, but not specifically specific programs. It talks about finding partners. It talks about being subtle about language. It talks, for example, about something that I found it particularly interesting about saying, like, let's not talk about population control. Let's say family planning, like in a very specific way, because if not, it becomes very aggressive, and we don't want that. It also makes an assessment of these countries have no particularly form academics or providers that can provide this, so we need to tackle that, because they need to be we cannot send like practitioners. We need to be based on local knowledge, and so we need to find these partners to facilitate these connections. But I don't know if you are interested in the document. I am happy to send it. So that's great. And about the Bucharest conference, I have not thought about the particularities of the conference itself. Ecuador was very, as a political position, Ecuador was eager on participating on international debates, because until basically the end of the 70s, most of the social programs really rely on external funding, because Ecuador changed the economic dynamics after petroleum was found in the Amazon. So, and that happens by mid-70s. So before that, or even after that, after exploitation really happened and the economic model change, Ecuador was focused in finding as much money as possible. But there were not many sources of money available. So so that's a particular position of going to all this conference and trying to align with as much as possible with the US and the US government, because that was the major partner. Yeah.
Thank you, Rebecca, for your question. Now, more than anything, I would like to ask you back what exactly in the construction of knowledge you are studying. So I'm hoping to find out more about that soon. Yeah, since you asked, I've been thinking now about study designs for the Colombian pilot programs of the early 60s. And the short answer would be, I don't really know if they had like a particular, like specific models from other countries and places. I did not find that in my sources. I mean, it's full of international recommendations from these US advisors. And so we can assume, since the first, thinking globally, their experience comes from Asia, I guess. But I never found something like an explicit, like a source that would say, okay, we have this concrete program in this concrete place that has worked this way, and you should do it similarly, at least not in the beginning. Then, of course, over the decades, everything becomes a bit more sophisticated, but actually it's very, I mean, they have this logic that when they start, these sources transport the logic of every underdeveloped place works kind of like the same way, and you don't really need to specify where you're taking your examples from, as long as they're somehow from the developing world. But then, of course, Andrea talked about the IPPF, right? And those networks, the Population Council, for example, also had international gatherings, for example, specifically on the IUD. They had like IUD global conferences in the mid-60s, and Colombian doctors would travel to those conferences, and they would report in those cases on what they heard in Asia and how fascinating that is. So there is this kind of global exchange, but not in this, I did not find it on the sense of practical program outline modeling, let's say. Yeah, I keep it there. Thank you.
Thank you so much. I have to run, but have a good session.
Thank you. Okay, Sebastian, you have a question?
Yeah, thanks for the presentation. I'm so sad that Rebecca had to go because I wanted to say something very useful into that, because you're right, Teresa. It's really difficult to try to find, in the case of Candelaria particularly, somewhere that the idea of community health came from. It's not very clear exactly what the origin is and stuff, but I have some things to say about that, and maybe I'm just gonna leave it there just because it's sort of a longer conversation, but it's super interesting. Thank you both for the presentation as well, and I'm very happy to also hear the work that Teresa has done in Colombia. We've had conversations before, and I wanted to sort of direct my attention to one specific thing that you mentioned, and then I have a question that's for both of you. So you were saying, Teresa, at the beginning of your presentation about the Club de Madres that you found as part of the Candelaria program, and I'm super interested on that particular idea and what happened there. I wonder if you could elaborate a bit on that, mainly with this theme that you elaborated in the rest of your presentation, which is that there is a tendency in all of the tensions that we see, the tendency to displace or disregards women's body autonomy, and underlying that idea for me as well, as I'm working through my own data, I wonder to what extent the Club de Madres was also a way through which the Candelaria program, for instance, institutions like the Rockefeller or the WWII, use that to also displace the autonomy of local communities, essentially because the Club de Madres seems to be presented as an initiative from the institution, but actually in the community, there were already very important ways in which the population, including women, were organizing as a matter of rural development and things that were before Candelaria, which the pilot program seems to have appropriated. So I wonder if in your research about Club de Madres, there's anything about that tension that emerges there, and if that also speaks a little bit about what happens with these community health approaches. I'm obviously asking about that because the pilot program in Candelaria wasn't a reproductive health program in itself. The reproductive health was an element of it, but it was aimed at other sort of bigger goals. That's the first question that I had. And the second one for both of you is that I have had the chance of looking into some of the feminist movements in Latin America. And in this time frame that you guys have been revising, there seems to be more or less a loose connection with leftist politics. It's not clear whether it is or it isn't. If it's actually in Connecting Three Worlds, we use this term by design or by default, that these feminist groups were actually leftists. I wonder if you've seen anything related with that, if you know these case studies or these examples were labeled leftist, for instance, by the opposition, which did happen to the Candelaria program. The directors at some point were labeled leftist, even though they were part of the socioeconomic elite of Cali. Or in itself, the movements and what they did saw themselves as leftist because of what they sponsored and what they were pursuing as political goals. So I hope that's clear. And yeah, thank you both for the very stimulating presentations.
Thank you. Is it okay, Andrea, if I start? Yeah. Thank you, Sebastian, for your questions. I would need to think for quite a while to have a good answer, but I'm gonna try with short and first answers. The Club de Madres, I'm sure you also work on Candelaria. You're familiar with the book. I took that from this 1962 book, And I'm not sure, and I haven't reread it now. I'm not sure how Torres Rendon in this book describes the club. I find it, I mean, in general, the whole description of Candelaria is impressive in the sense that there are so many levels of self-organization described, right? And I guess it's hard to say in how far these reflect some kind of reality, in the sense that these people actually gave life to these self-organizations, or if they only came and posed for the picture and left their own and left again. I just know that in the family planning case, but also the wording between the English sources and the Spanish sources don't always match, and I'm not always sure if they speak about the same thing. The Club de Madres does not really appear in the English speaking or in the English language sources by Rockefeller, etc. There the relation between family planning and other health programs is nutrition more than anything. So the first family planning recipients, or the first families who are included in the family planning program, are the same families whose children are treated for undernourishment. So the courses they receive, they not only imply family planning methods, but also nutritional aspects or general childcare aspect. So there's this connection. And I think, but I found it interesting that you said, well, this was not about reproduction, this was about community development. I think it makes that makes or much broader goals pursued there. And I think that's of course true, and that's true if you look at it from that side. But if you look at it from the larger family planning side, then Candelaria also becomes just one of 5 or 6 places where family planning programs were started at the same time, were always started in connection with some medical school. And people who worked in that area, they didn't care so much about the larger community development issue, right? They cared about which methods could be, which methods local authorities had agreed on, whether or not people were using them and understanding them, and well, after a couple of years, whether or not that was reflected in birth rates after longer time. So I think it's maybe both. I mean, you always have those specific programs under the umbrella of community development that also belong to kind of a knowledge production of their own. And the second question, I think I really don't know, like whether, I think it was, did I understand you right, whether or not the feminist movements of the 60s and 70s, or rather 70s, auto-labeled themselves as leftist or were labeled as such? Was that the question? And well, if it was, then I really don't know enough to give you a public answer. Thank you.
About the feminist movement and the left in the 60s, I would say there is not even the label of feminist movement. I will say it is much more a movement for women's rights. So the label feminism will not necessarily be present. And for the leftist movement, that's quite interesting, because there is also a dislike for the word feminist later on in the 70s or 80s, like the socialist groups were saying like feminism is a US term and it's a very bourgeois term, like this is middle class women asking for specific things, very based in individualism and not necessarily in community things, community interests. However, the women in the leftist movement will not agree with that, and some of them were sanctioned because they felt like feminism was also important to be discussed. So there is a huge tension in the 60s, 70s and 80s in Ecuador. Nowadays, it is very much related to the left. So it's very clear the left is still very misogynistic, I would say, in Ecuador, but the feminist movement will be much more aligned with the left than with the right. if that is a broad answer to that. And I will also answer Susan's question that is in the chat. She's asking to both of us, are the family planning programs approaches the same in urban and rural areas? The focus seems to be in urban areas. And for Teresa, I was interested in photographers and photography in your presentation. Do you know how these photos were used at the time? So I will use the time to answer the part of urban and rural. I think, yes, there is a difference between urban and rural approaches. In my case, it's very urban, but I would say it's for different reasons. I think they are very interesting reasons. I think one is the capabilities of the state. As I mentioned, Ecuador was a poor country with very low capacity to deal with the needs of the population in different areas. So urban areas become places where the state can really do something, or they can see what is happening and do some interventions. That's on the one hand, but in the other, it's the indigenous, let's say, as it was said in the time, the indigenous issue that happened in the Andes. So it's still in the 60s and 70s, there was a huge indigenous fight for demanding rights, which made them a very challenging population to be intervened by the state, which I found very interesting because they remain as communities that were fighting for the rights as communities, but they also were not the target of these state interventions for family planning because they couldn't be. They were fighting a different fight and they were interacting with the state in a different way. And there was also not the capability for the state to interact with all these communities. Interesting enough, Marangoni, which was the man that I was talking about a lot in my presentation, presented a paper in an international conference about making alliances with sugar company, a sugar refinery, to provide sexual and reproductive health services to the people that were working in the refinery. And that is kind of the partnerships between enterprises that were happening to do interventions in rural spaces. But yeah, it's quite interesting, but not necessarily the focus of my research. So yeah.
Also from my side, thank you, Susan, for those questions. And I'm going to jump right in there because I didn't know that, Andrea. And we had that, or that existed in Colombia as well, cooperation with the sugar industry and family planning program for the families of the sugar workers in the Valle del Cauca. So maybe we should look for that connection, if it's a coincidence or if it's actually also on a higher level, someone who was promoting these kind of public-private partnerships. In general, the example I've been referring to most, Candelaria, the researchers themselves would call that a semi-rural community because it had like a small town and then several villages around, and they worked in all of that area. In general, they are not the same in the rural and the urban areas, but I have worked less on the programs and more on the research. And from the research side, I can tell you that, for example, the rural-urban divide was always a very important category for the researchers, maybe even more than something like class. Of course, they expected the rural population to be less literate, less educated, less. There's a class dimension implicit, but it's not the terminology is always between the distinction between urban and rural, and they have different surveys, for example, for urban populations and for rural populations. So they expect different kind of knowledge and different kind of ability to interact with researchers and to be able to answer their questions. And in general, when it comes to program or methods, the less educated the family planning proponents expected their target populations to be, the more inclined they were to use irreversible or methods such as the IUD, right? The pill was reserved for urban middle-class women who they trusted could understand how to take it. But yeah, and then also like I think also it's interesting that in the rural part you have all kinds of different cooperations that really depend on the regions, like the example we just had with the sugar industry. But in Colombia, for example, there's another scholar, Mary Roldan, who has worked on family planning in the Colombian countryside, and cooperations with the coffee grower federation, who also got involved in family planning programs on the rural level. And also in certain rural areas, you have sectors of the Catholic Church very actively cooperating with the family planning programs. Yeah, so maybe so far. And yeah, as for the photography, the pictures that you saw, most of them were from this one researcher, Stykes, a US sociologist who was super important in population funding and networking in Latin America. He worked for the Population Council for many years. He also worked for his university, Cornell. He conducted a lot of studies. He directed a lot of studies. He was in Latin America all the time, and his photography was really more of a hobby. But he also published those photos, and like according to him, maybe the pictures I showed you were actually scenes of family planning, but most of the pictures he shot or published were actually portraits of children living in poverty. And he publishes those, as I said, without any real explanations on when he took it and where exactly he took it, to give like a human face to the statistics and to show this is what poverty looks like. Look at those children. They need fewer siblings, or again, that was the message, right? And those publications, they work like catalogs, so they only have the photos, and they have like quotes that are supposed to be from interviews with these people, where they say things like, "I wish God would send me fewer children," stuff. But again, those quotes are not contextualized at all. They're just like one big sentence in the middle of a page, and then the poor, badly clothed child. And yeah, just yesterday I was looking at one where I found it really amazing how he the logic behind it, because he says like, this is, look how beautiful these children are. It's hard to believe that there is a problem. Like this, like how do you do that? Show specific people and then say that your goal is for less people to be born, right? And but he somehow frames it in a way that it makes sense to him and maybe to his readers. And they were also he also organized expositions in the US. And some of the photos are by him, but then he also published a book. It's called Margin of Life, together with Cornel Capa, a professional photographer, brother of the more famous Robert Capa, and that was in the mid-70s as well. And I think he, I interviewed the Stykes in 2010 when he was in his 90s, and his house was full of like large scale photographies, mostly from China, where he worked on later. But yeah, so that's just a sociologist who had this passion and also used it for, in a way, it was propaganda, because all these books had the purpose to transport the necessity of population control.
Thank you both. And there's nobody raising hands, so I have some questions. So first, I want to ask both of you, what are the long-term impact of these women's movements in the Cold War period? And because I'm quite ignorant on this topic, so I was wondering, like, what is kind of like reproductive rights in Colombia and Ecuador currently? And Teresa just mentioned the Catholic churches. So are there any like conflicts with the women's rights movement and the religions and the church? And the second question is that you both mentioned like family planning programs in Latin America was quite promoted by organizations from the United States, like USAID and Rockefeller Foundations. So I was wondering, there are any other actors who are promoting the family planning programs like the WHO or like WHO. And I know like also in the case of China and India, it's like the countries from the Nordic countries were quite active. Like there was Danish development agencies and Swedish international development agencies was quite active promoting the family planning in China. And I'm sorry, it's very long. And there's a third question that I was wondering, like, what source do you find like most valuable in researching this topic? And are there any like challenges you faced given the sensitivity and the political nature of the subject? I think that's all.
Thank you, Lu. I really like your questions because I have been thinking a lot, particularly in the one on the long-term impact of these programs, because I do think they have a very important long-term impact. I try to hint that my position in the first part of my presentation, so the idea of the responsible parenting and the ideas of control for control. So in Ecuador, still today, you have high numbers of unwanted pregnancy. You don't have any, you don't have a national sex education program, so that's not mandatory in the Ecuadorian curriculum. You have a very large number of teenage pregnancy. So it is still a huge issue. And one of the things that is a legacy is that this was never a matter treated with the community, for their community, or as a health policy. It was something treated in a very technical way about providing access to a technology and saying, hey, you can take this, do that, and you will have better results. But the relationship of the community with the technology, with the information, was not there. So there was not a cultural change in the way of thinking about sexual and reproductive health promoted by the state. So the thing that was promoted by these institutions and by the state was much more of a technical implementation of, hey, you have these things now, do something better. And the results were there. However, these results have changed through time because it is basically dependent on the access to this and not on a broad societal change about the way we can understand women's bodies or body autonomy or just sexual and reproductive rights in a broad sense. So I think that's an interesting point. It's a difficult point to make in the long term, but I think that's relevant to understand. And the theme about the Catholic Church, I found that very interesting because Ecuador is a very Catholic society. It's a very conservative society, but in priorities at the time that I was discussing between the 60s and the 80s, the priority was, let's make these people have less children and let's take a little less concern about the souls and the church. So they did a prioritization of, okay, no, we need to go with the international development agencies ideas. We need to do this for the state. And the discussion about what the church thought was not as present, which is very interesting because the church was always saying, like, this is wrong, this is not great, we are not supporting this. However, that voices were silenced at the time. They are very relevant, they are still very present, but they didn't take priority at the moment in the discussion. So the discussion was other. The discussion was about population control and poverty control and making it happen, silencing a little bit the voice of the church, which I found very interesting. And then, yes, the US government was all over everywhere, but so was the World Health Organizations. The wording of the programs of the World Health Organizations was less problematic, let's say. They were much more inclined in talking about maternal and child health. So again, women were not central, it was the combo. It was always the combo, mother and child, mother and child. They were much more focused in maternal mortality and the discussion about contraception because many pregnancies will make life for women more difficult and women's health more difficult. The word was different, but they were there, and they implemented a lot of programs. They funded a lot of programs, national programs as well. And the sources, I really like your questions. The idea of the sources make me want to complain, because the way I'm thinking about this research is to go to Ecuadorian sources to understand what was the logic of the public health policies working in the ground, like what were the physicians working in the Ministry of Health thinking, what were the politicians thinking. However, those sources are not necessarily available, and they are very patchy, and the way Ecuadorian archives work is not necessarily good for creating memory. So it's very difficult to get access, and when you get access, it's very difficult to find information because some information is just gone. So I am trying to work with the approach of what was happening, not from the international organizations' archives. We have very good reports, and most of them, and they can be found online. But I really wanted to make a point of going to the national archives and see the other side of the conversation and what was happening there. But it is very challenging, very challenging.
Thank you, Lou, for the questions. I'm going to try to be brief, and I'm going to start at the back with the sources. I've faced the same challenge, and it's hard to say which sources are most valuable, but it's for sure in my case, when the sources I was looking for were mainly everything that was somehow related to the knowledge production, right? So everything that concerns the research, the funding, the research proposals, then the questionnaires, the description of the interview process, etc. And in general, it has been, I mean, I found a lot of material in Colombia, but the things I found in Colombia were mostly like reports or first results. And from the US side, you have all those work diaries, right, where people actually describe interactions, describe day-to-day processes at the places they're at. And I think that those are great sources for many questions about US development thinking, and many, but of course they are limited sources when it comes to the perspective of the places that people were at. So you can read those a bit against the grain, but you always find yourself, well, I always find myself with the problem that, oh, okay, so you tell me now what these Colombians told you. I really wish I had those Colombians telling me that without your filter, right? Other organizations, I worked mostly or most thoroughly on the 60s and 70s, and there it's really a strong US dominance in the field. The only other agency I found was the Swedish one, and then yes, maybe United Nations Population Fund at some point comes in, but also on, yeah, it's very US dominated. Long-term impact, I think there may be better people here in this Zoom circle to even answer that. Maybe Paula or Sebastian want to say something about that for Colombia. I wouldn't really dare to respond it when it comes to like the status quo of reproductive rights. I know I should be, I wish I could answer that like without looking anything up first. I can just tell you that from the organizations that come from this period, I mean, in Colombia, you have like two big players. One are the medical schools. And I mean, in my presentation, I always spoke about the medical schools. Actually, the Association of Medical Schools, they create a population division. And this division doesn't survive the 1970s, when in Colombia, there's a similar backlash against family planning as an imperialist conspiracy that Andrea described for Ecuador. But the other big one is Pro Familia, which would be the sister organization to APRO. What's the they always are called so similar in every APROFE in Ecuador. So the Colombian APROFE is Pro Familia, and they are still a very maybe that's also when I was in Bogota, I lived like only meters away from the headquarters, and even the bus station there is called Con Familia. So to me, they were very present, but I think they are a well-funded and active organization. In general, family planning in the 70s moves into this more general area of mother and child health and continues to be part of public health. How effectful and or with what I cannot tell the details for the 80s, 90s or the present, but numbers did go down, as in many parts of the world, and demographers in the are not sure. I mean, it's hard to say afterwards why, right? I mean, actually, they rather come back to socioeconomic factors such as education at work in their explanations, and not so much to the merits of the family planning programs. I guess family planning advocates of the past and present would probably see the causes differently. Yeah.
Great, thank you so much for the answers. It's great sessions. And I was wondering if anyone has questions, or if you would like to ask each other some questions, or even have some discussions.
Yes, I do have a question. It's more than a question. I was very interested on I also see the important point of family planning opening spaces to discuss sexuality, sexual and reproductive health, like the idea of the door opener. I wanted to know your thoughts about that, because I agree, it was at first an initial interesting point, but do you know how different groups use that further, like how they push this very initial idea into something else, or do you have any comments on that?
Thank you, Andrea. I don't know if I can go there on a much more general level than the examples I was using, but I do think it's interesting that feminist or progressive scholars start their careers in this environment, and I do think you can see that as an appropriation, right? Because they, I mean, one thing of the family planning story is that it came with so much money, and if you wanted anything to be funded, that was somehow, I mean, from other case studies about family planning, we also know that even physicians, for example, who are interested in maternal and child health more broadly, they frame their projects as family planning because that's what they're gonna get money for. And I think this sex education survey that I was talking about goes in the same direction, that this was not someone explicitly interested in family planning and someone even hesitant in collaborating, but this is who gave her funding. So this is like on the more practical level, I think a strategic use of what was there, and on the more discursive level, to me it is somehow convincing that all this talking about family planning at some point had to lead to also talk about sex, right? And that when reproductive organs were shown to so many people, this had kind of, that this changed minds and discursive spaces. It makes sense to me, but I cannot say much more. And Paula is offering to comment. I don't know if we still have time. I would of course be interested in hearing that, but I'm also, because Paula is also doing research on that. My question to Andrea would be, in one moment of your presentation, I felt like you were quoting a woman, and I was wondering where you're quoting from an interview. Like, have you been conducting interviews in order to strengthen both the female and the Ecuadorian perspective of your history? And if yes, then what was your experience with that?
Thank you. I will definitely say, Paula said I could comment on the role of feminist movement and the feminist activists in Colombia, if Teresa is okay with it. Yes, please, Paula, sure, we will appreciate that. Do you want to go now?
Sure, I can be very brief. I think that functioned at like different levels. So for instance, there were like individual women that were taking advantage in the sense that Teresa was mentioning. And that was at every level. So for instance, the promoters that worked for Pro Familia, and work is quote unquote because many were volunteers or were paid like very, very little money. When you ask them, they tell you like, yeah, I heard about the population issues and like the importance of birth control and so on, but I actually cared about the condition of women. And that was the reason I was doing that work. So in a sense, that happened at an individual level. And it also happened, for instance, with Magdalena León, that was part of the population division of ASCOFAME, the Federation of Medicine, of Associated Faculties of Medicine. And she had like 7 years of funding from Rockefeller, and they were like giving her money for doing research on the demographic structure of Colombia. And after 7 years of she sending reports saying that what she was doing, she handed her final results, and was a book on family structure from a feminist perspective that was actually all about like how rural women are actually who support the system in terms of like not only rural families, but also the production of agriculture and meat and things like that. So she definitely knew what she was doing. She was receiving that funding. She was sending reports that sounded like she was making progress in that sense, but she was actually interested in other things, and she used it that way. And just the last thing, there were also other groups of women that were just feminist activists, and that they were not pretending to be doing anything else. And those women have been less studied because it's harder to find the sources in terms of like what were they doing, but they were organizing sexologist congress, in which they were not talking about family planning in terms of abortion prevention, but in terms of like promoting pleasure, of allowing women to experience their own sexuality in a broader sense. So all of this was happening at the same time. It's just like harder to try to like follow in terms of what it's available for the sources.
Thank you, that's great. And also the strategic use is what Teresa was saying, like the strategic use of funding to do what you were meant to do, but also do what you were aiming to do. That's very interesting. Sebastian says also this because that's what a lot of what we find in the research with the focus on Latin America, the strategic use of resources in organizations. So about the sources and the quoting women, the quote that I use, that particular quote is for the memoirs of the organization for an anniversary, because they were saying like, oh, this is what our workers were hearing in the ground, so it's part of an institutional memoir. I am conducting, or I have been conducting interviews to fill the gaps of what was happening in the implementation of these programs. You make me remember one particularly interesting. So this conversation with Paula also made me remember this, the interesting things that happen within the institution that were not necessarily part of the institutional agenda. For example, you have very vocal feminist leftist people now that advocate for abortion as healthcare, and that they are very progressive and very interesting to look at in the current feminist movement, that come from having connections with a prophet, for example, that when they were young or when they were starting their activism, they had some connection with this organization because this organization was the only one doing this. Even though they are not partnering now, they will definitely be they are definitely not doing the same, and they don't really like each other anymore. They come from that background, which I found very interesting. And there are still people, I interview people in Aprofe, and the people that have been there for decades. So the people that basically started to work with the organization, or they were very young when they started working with the organization, also talk about relying in community activism that then transform into something else, because Aprofe, it is a private organization that provides healthcare now. So it's interesting. I'm trying to use interviews to fill the gaps, but also it's not easy, because sexual and reproductive health is still not an easy topic to discuss. Even more when you are working or trying to do interviews with people working in an organization that nowadays have a very conservative way of talking about sexual and reproductive health. So by the time they were progressive or interesting in what they were proposing because they were unique, but now they have transformed into a very much conservative discourse. So for people to talk about those different moments on the institutional history, it's complicated. Yeah.
Yeah, Teresa, if you wanted to.
Not just one little thought that I wanted to say earlier in the Colombian case with Pro Familia. Actually, this was the only archive where that wasn't open, like where I felt like I went to the library, and I'm pretty sure they also have an archive, and they were very reluctant not to let me in. And I think that's because of the whole legacy of being accused of cooperating with the US, etc. And they don't really want anyone to dig into that more deeply. That was kind of my assumption, maybe.
That's very interesting, because I feel a very similar vibe. They did open their doors to me, but first they don't have an archive. They have institutional memoir, so they gave me all the institutional discourse, and they were very happy to provide help with that. But they were also there was a very curated discourse, highly aware of what they were saying. And there was an interest of discussing the past, but within the narrative that the institution have created. Because yes, it is different now. They had a position before that they don't have anymore. Yeah, that's very, very interesting. And I think, yes, Lou.
No, just you continue if you have any other.
No, I was going to say, if no one else have questions, we can
wrap it up.
Yeah, finish the conversation here. Thank you, Teresa. It is a really, really cool conversation, and I hope we keep talking about the sugar refinery thing, because yeah, I would like to explore something like that. I have very little information, but I found it very weird, that connection. So thank you for accepting present here, and thank you for the people that have shared their questions. Yeah, I hope that we still engage in conversations about these topics. Yeah.
Okay, thank you so much, Teresa and Andrea, for your presentation, and Andrea for your organizing this amazing event. And I think maybe we can just wrap it up here, and hope you all have a great evening, and maybe we can keep the conversations if you want. And also we'll upload the series on the YouTube channel, so you can keep up and follow it. Thank you so much.
Thank you, everyone.
Bye-bye.
Bye.